Hello, everybody. This is Gary. Today is Monday, September 5th, 2022. It is 11:37 a.m. Eastern Standard Time in the United States in Rochester, New York, and this is my coping with schizophrenia log entry for today. Today I'm doing pretty good. It's raining outside here in Rochester, New York, and the weather's a little bit cooler. Um, so summer is coming to an end. Um, Today, my psychiatric symptoms are not that bad. Um, my paranoia is not that bad. My delusions are not that bad. My auditory hallucinations are at a bare minimum. Um, my depression is not that severe. I'm just sticking to my daily schedule today. I'm going to go out for a long walk and do my physical therapy exercises for the pain in my body and the pain in my right knee. I had surgery on May 13th. Most of the pain in my knee has gone away. I had surgery to remove part of a torn meniscus, which is sort of like cartilage in the knee. There were no broken bones. Um, I had last week a urinary catheter pulled out that I was wearing for about 2 weeks after the emergency room inserted it. I had difficulty urinating, and so I had a urinary catheter and a urinary leg bag. Um, we thought it was possible that my Zyprexa was causing the urinary retention, and so we cut my Zyprexa in half, which is a little bit risky because I take Zyprexa for my delusions, paranoia, auditory hallucinations, psychotic depression. Um, but I think I'm pretty stable on the lesser amount of Zyprexa. We went from 20 milligrams a day to 10 milligrams at nighttime. Um, I'm still on all my other medications. None of my other medications have changed. Um, I am seeing my therapist on the 8th, which is this Thursday. On Friday, I have an eye exam because my vision is kind of blurry. I don't think it's caused by my psychiatric medications. I think I'm just getting older and I need a new prescription for glasses. So I have an eye exam on Friday. I'm seeing my psychiatrist, I believe, on September 23rd. I'm seeing my peer support specialist on September 15th. A peer support specialist is somebody who has a mental health diagnosis and works on staff at my clinic as a counselor to help me with my symptoms and to help me reach certain social goals that I have, like making new friends. So I have a whole team support. I'm also working to get a care manager who will help me deal things with like my health insurance, getting food, paying rent, that kind of thing. Things related to my mental health, um, transportation to and from medical appointments, and other things like that. Um, Last Friday, I had difficulty urinating. I went to the urgent care center at St. Mary's Hospital here in Rochester, New York. Um, Turns out I had a urinary infection. They prescribed an antibiotic. Um, and that was probably the cause of the urinary retention the second time around. I did not need a catheter, and even if I did, I would have had to have gone to the emergency room because urgent care doesn't have, at least not the one that I went to, didn't have any urinary catheters and urinary leg bags. They don't do that at the urgent care center I went to. So even if I needed ultimately a catheter again, I would have had to have gone to the emergency room, which I loathe doing because both the psychiatric and medical emergency room at Strong Memorial Hospital are totally fucking chaotic, and you wait hours on end just to be seen by a medical doctor or a psychiatrist in the case of the psychiatric emergency room. Um, The longest time I've ever spent in the psychiatric emergency room waiting just to talk for 10 minutes to the psychiatrist was like 22 hours. That's a long time to be sleeping on a fucking chair in an emergency room, because that's what you literally do. You sleep on a chair or a couch because that's all they have, and you wait for the psychiatrist to talk to you in a conversation that lasts about 10 minutes. It's total fucking chaos at the psychiatric and medical emergency rooms at Strong Memorial Hospital. But if I need to go, I go, because those are the only places that I know of to go, and all my doctors and psychiatrists are connected to the University of Rochester Strong Memorial Hospital, so they all have access to my same medical records. So that's the way it is here in Rochester, New York. I can't speak to any other places. Other than that, there's nothing much else to report. I'm doing okay. And I'm going to stick to my daily schedule. I do consumer surveys online for extra money. I'm making this video. I'm going to do my walking and exercises and do my morning meditation, which I've already done, and my evening meditation, which I do before I go to bed.